Hello friends, are you planning a pregnancy or thinking of having a baby? Then my advice to you is pre-pregnancy health check. I am Dr. Veena Ganju Malla, a senior consultant in OBGY at Rosewalk Healthcare. I deal in high-risk pregnancies, infertility and pelvic floor reconstructive surgeries. A healthy pregnancy is closely related to your health at or just before conception, and it's important to have pre-pregnancy care to have a healthy baby. Now, I am going to share some tips today with you for this pre-pregnancy care. My first advice is all those couples who are planning a first-time pregnancy or have had a pregnancy failure in the past, or they know that they have some kind of medical condition, because all these people need to optimize their health just before planning pregnancy and need to meet a doctor. If you have problem in planning pregnancy or you are not getting pregnant, then also you must come and visit us. So first and foremost is visit to a doctor. And what does a doctor do? She will assess your health condition, ask for some medical conditions or history, perform certain lab tests, or also take a family history for any genetic diseases. She will assess whether you have a diabetes, hypertension or thyroid disease, or do you have a thalassemia. All this can be diagnosed and optimized before you enter that blissful journey of pregnancy. My second advice to you is preconceptional folic acid supplementation, and this is a very, very important thing. All those prospective mothers who are planning pregnancy should see that they take one tablet of 400 microgram folic acid at least for 3 months prior to they actually conceive, because most of you come to us when you're either already pregnant and you have missed that important period because you conceive before you miss a period. So that's very important for all of you to understand. Now second, what does this folic acid do? It prevents certain neural tube defects, that is the defects of the brain and spine. So it is, friends, very, very important to take this. Third point or tip I want to share is eating right. Now what is right for most of us? For those couples who are planning pregnancy, eating a folate-rich diet, which means spinach, broccoli, nuts. So you should see that on your table you have, all colors, which is very colorful if you have diet, which means that you have something green, which is maybe spinach, or you have an orange, maybe carrot or a citrus fruit. You have a yellow color, maybe a banana. So all this will give you a lot of vitamins, minerals, and it will be very important in your forthcoming pregnancy to have a healthy baby. Now fourth one is doing right kind of exercises. Exercise cannot be overemphasized. It is very important in your day-to-day life also, and especially so before pregnancy, and it should continue even during pregnancy as per your doctor's advice. Now exercise, what does it do? It will help you in your weight management, plus it will strengthen your muscles. It will make you more energetic and it will give you a healthy baby. So friends, must exercise before pregnancy to maintain an ideal weight. But my caution is, do not do crash diet. Have a well-balanced time management plan, say maybe 5-6 months if you are overweight. Next step to you is maintaining a good orodental hygiene. It has been seen that, orodental hygiene is connected to a lot of complications during pregnancy. So a visit to dentist before pregnancy is a must so that you can avoid those complications like preterm births and all. Next step to you is lifestyle changes. And what are they? Quit smoking. I know it can be difficult, but it has to be done if you want to have a healthy baby. Stop alcohol or any other recreational drugs you must be taking, and cut down on your coffee. If you are a coffee lover, the recommendation is 200 milligram per day, which you can take, but avoid as far as possible. A word about vaccination. If your vaccination schedule is not complete, we are there to help you. And immunization can be done before you are planning pregnancy for diseases like rubella or maybe hepatitis, and injections can be given, and you can defer pregnancy for a month or two and then be ready with your self-defense and enter this journey of pregnancy. And lastly, and not the least, you should have a stress-free period before pregnancy. And how it can be done? By meditation, by interacting with your loved ones, spending quality time in whatever you love to do most, and baby mourning or spending quality time with your husband is a must. A word about COVID. There is limited data as of now as to the effect of COVID on planning pregnancy, because it has not been shown to increase the severity of disease in with COVID. So till we have more this thing, there is no harm in planning pregnancy as of now, but practice all the safe distancing and other measures which are applicable for COVID. I hope these tips were useful for you. If you have any queries, you can always reach us at Rosewalk.